Hello, welcome. Hello and welcome. I am Amy Nelson of Wild Valley Studio, the host of tonight's event. Thank you all for being here. And now I'd like to introduce candidate for Oregon State Representative of House District 24, Lynnette Shaw.
Thank you. Thank you, Amy and Jordan and Wild Valley Studios. This is by far the best platform we've been on for electronic presentation to voters. So thank you for doing this. I am very appreciative of it. I want to tell you a little bit about myself. I am as Amy said, my name is Lynnette Shaw. I am running for the Oregon House in District 24, which is McMinnville, Carlton, Lafayette, Yamhill, a little bit of Gaston, basically wine country, but it does go up over the hill and into the southern part of Hillsborough as well. So we do have a little bit of Hillsborough and Cornelius that are also in the district. And as for myself, I'm a small business owner, and I wouldn't necessarily call myself an accidental politician, because how I got to this place has definitely not been an accident, but I'd rather call myself incidental politician, meaning that I'm here on purpose, very much on purpose, but also very much as a consequences of developments within my community. I think I'm not unlike a lot of folks that prior to 2016's national
Uh-oh.
and sometimes I volunteered for campaigns and that spoke to me and to my values, but of course circumstances change. And after that election, I really stepped up my role as a community organizer and refocused my attention on local politics. The Republican walkout in Oregon's last regular session in February is absolutely what lifted me out of thinking that running for office was somebody else's job. Watching that, what I consider a very anti-democratic assault on Oregon's democracy, and then I was wondering, like, well, who's going to step up and put a stop to this? Who's going to do something about all this obstructionist politics? And then, I just decided that someone was me. My early background is very much working class. My parents were first generation, both of them, first generation off of a ranch and out of poverty in rural California. And they relied on public service jobs to build a life for themselves and their kids. So my dad got a job, a union job with the fire service. He was a firefighter. And with that job came healthcare for his family. It came stability for his family also, that with a high school diploma and barely a high school diploma under his belt, that was not necessarily very accessible at that particular time. So and then when he went to work every day, we knew he was going to be safe. He had the best safety measures, and it enabled my parents to buy a house and build generational wealth for a family, and enabled me as their next generation to kind of set me up to reach for my dreams for the most part. But that, and him working in that public service arena and having those deep public service roots, there are 3 generations in my family in the fire service, and so they're public servants. It really taught me a lot about what it means to be of service to your community, and it taught me that nothing gets handed to you, and it taught me about what commitment means, and so that kind of is what set me up to feel like I could be in this particular arena at this time. So that's pretty much a little bit about me and how I got to where I'm at right now. And hopefully we've got some folks here that have some questions about the campaign, or I would like to really make this a dialogue with folks rather than a monologue. I'm not a fan of monologues, and I want to hear what's important to you, and I want you to ask me questions if you might have questions about my my issues or anything else. Do we have any questions in YouTube?
Yeah,
I can talk about healthcare if you'd like.
Oh yeah. Yeah.
Healthcare is one of the issues that is very near and dear to me. I have a public health education and background. I worked in healthcare for a bit, and it is something that I think is, as we point ourselves toward COVID-19 recovery, we are really going to have to address some serious issues with our healthcare, because prior to the current crisis we're in, the system that we have in place to care for us, that really was attending to the physical and the mental health of our community, was really, really inadequate to fully meet our needs. We had a lot. Can you hear me?
yes.
Okay. How far did I get? Okay. So did we talk about?
Mm-hmm. Yeah, let me. You were talking about you just began sorry, you just started talking about medical care. It was maybe 2 minutes into that.
Okay. And you can hear me now?
Yes, that sounds great now.
Okay. So did we talk about how many people in Oregon have coverage, but still people go without care?
No.
Okay. And that's kind of the crisis that we're seeing here. And that has to do very much with affordability. So basically, Oregon has pretty good coverage. So we have the majority of our, I think it's somewhere around 90% of our population is covered by healthcare insurance. But the premiums on on that insurance and the copays on that insurance, it's become more and more costly over time. And so folks are technically able to seek care, but it's become so expensive that people end up delaying their care and rationing medications in order to stretch dollars, their healthcare dollars. And we see things like drug prices that are gone through the roof and persistent issues of access and affordability, especially in rural communities, and inequity in delivery, and then really disparities in outcomes. And that's become the norm. That's become what we have dealt with over time. But the dominant narrative, or what we're hearing from a lot of politicians, certainly at the national level, but even at the state level, is and certainly in this district, is one that pushes that conversation to the side because they say it's too expensive or it's unreasonable to address in a meaningful way. And other issues kind of pull at our attention in our budgets, and then we end up putting patches and half efforts in place, and we never really quite prioritize the larger changes that we need to get all Oregonians on a level playing field. And then, here comes COVID, and it really lifts that curtain very tragically on all the disparity that we have built into this system. So about half of Oregonians rely on commercial insurance, usually through their employers, which of course has proven problematic at a time where we're seeing really dramatic shifts in employment. And then the average cost of premiums and deductibles have actually risen faster in the last decade than workers' wages have. So working people on the whole are actually losing economic ground by taking part in the best possible scenario to get the best insurance that they can for themselves and their family. They're losing money. And that's without even factoring in drug prices, which we've seen to have a median, I think the median price increase over the last couple of decades has been 230%, and insulin has risen nearly 350%. So that is a lot of price increases for drugs, and we all feel that. So I guess then the question is, what are we getting for our care with all those increased costs and from the drug and insurance companies? And what we're getting is persistent barriers to care, too much public distrust in our healthcare system, entire populations that remain uninsured, and deeply, deeply embedded inequities that have put racial and ethnic minority communities at significantly increased risk from our current pandemic. So that's kind of the situation that we have right now. And you'd think with that information, our current representative at HD 24 would take some action to protect our community. And what he has done instead is, I think he really lacks a lot of forward-thinking vision in healthcare. In 2018, the Oregon legislature passed what they called the Drug Transparency Act, which is meant to study pharmaceutical practices and pricing. But it was really a very, very early first step. It didn't have any teeth. And it just had a bunch of next steps and a bunch of data that now we can't act on because Republican legislators haven't been in their chairs long enough to actually take any votes on any of that. So here we end up in the middle of a global pandemic, and drug prices continue to rise. Working people continue to ration their medications, and we're really not any better off than we were before. And we're very poorly positioned for the crisis that we find ourselves in. The recommended next steps from that legislation were really left swinging in the breeze as your representative bolted out the door in an effort to prevent legislation from passing. So that's exactly what they did. The one bill that did slip through as a follow-up in 2018, which required drug companies to give enough advance notice of price increases to allow patients and their doctors to adjust and seek alternatives, actually received a no vote from Representative Noble. In 2019, he voted against fully funding the Oregon Health Plan. So that's a really big deal. That plan covers 1.1 million Oregonians, including hundreds of thousands of low and moderate income children. He voted no. on a bill directing the OHA to provide a forum for collaboration to design a better healthcare delivery system for Oregon's future. And he voted no to create on a bill to create a task force that was going to look at universal healthcare in order to explore how we provide a public option for all Oregonians. He voted no for that as well. And that's very achievable. It's not pie in the sky. In 2020, he also declined to send to the ballot a proposed amendment to the Constitution that would have obligated the state to ensure every resident has access to affordable, clinically appropriate care. He voted no. And to me, that's a huge value statement. And it tells me that he believes healthcare is too costly and too complex for the state to ever consider holding itself accountable for access. But he's willing to put that burden squarely on the shoulders of everyday Oregonians. And he essentially has voted in a way to provide benefit for insurance companies and corporate delivery systems that give his campaign tens of thousands of dollars. Actually, it's more than that. It's an outrageous amount of money. They really do fund his campaign. In 2020, he walked off the job leaving really good bills to die, including one that would have capped insulin costs, one to create community-driven organizations that work to serve historically underserved communities, and another to remove barriers for immigrants that are seeking health care. And that's not even addressing the $46 million federal grant that we could have had from the federal government. That is a grant that required 4-to-1 matching, so all we had to do was be in the legislature long enough in February to get about $18 million to add to that, and we would have received $46 million to put together comprehensive behavioral health treatment centers. These are very modern centers that are delivering comprehensive and vertically integrated behavioral health care for folks in the community, and they work. And we no longer have that. We no longer have the ability to do it because we didn't get that money. So those are things that those are real costs to our community when our legislators don't stay in the legislation and don't continue to pass bills and take votes. And I think we as a community have to decide if that's what we want or if we want a change. So we end up here in one of the most challenging and complex healthcare environments we've ever seen ourselves in, and we're really flat-footed because we haven't had all of these things happen that we couldn't address. But of course, it doesn't have to be that way. It certainly can. We can have a better system, and we can build a system that uses existing infrastructure to provide that public option. And that's a very low-hanging fruit. As I said earlier, I believe it can be done pretty easily, and anybody who needs care can get it without worrying about drowning themselves in medical debt or rationing their prescriptions or opting out of recommended care and follow-ups if it's been recommended to them. So we can leverage cost savings of providing vertically integrated health services like I just talked about with behavioral health. And we can do that in a really comprehensive, patient-centered, prevention-focused, and coordinated care model to lower barriers to care that are the origins of disparities in outcomes. And we can build cultural and civic power for those who've been really impacted by healthcare inequity. And Portland's Reimagine Oregon has recommended investing our healthcare dollars in culturally relevant behavioral health centers and funding culturally appropriate maternal health programs in all of our institutions, and that's fairly easy to do. And by doing that, you can start to address some of the really costly social determinants of health, like uneven access to social and economic opportunities and resources, and the quality of our schooling, and the safety of our workplaces, and the cleanliness of our water and our food and our air, and the nature of our social interactions and our relationships. Those determinants really drive 80 to 90% of our healthcare outcomes, but they receive only about 10% of our targeted funding. So it creates this system that really sags under its own weight. But we can reimagine that system. We can absolutely do that, and we can put more emphasis in a fee-for-service model, move it from a fee-for-service model, and put it to a value-based care model, which some European countries have been using for years, and many of the large insurers are now looking at this as a way to provide better care for more people at less cost. And those value-based care models basically are helping the providers to keep people healthy outside of the four walls of whatever clinical interface they're in. So outside of the hospital or the doctor's office. And it allows them to incorporate social determinants of health into healthcare plans, and it really does work for people much better, and it gives us a more equitable and more effective and less expensive system. So that's those are some of my thoughts on healthcare. Does anybody have any questions about that?
We do have a couple of questions coming from YouTube, from the YouTube live stream. The first one is from Amy, and she wants to know what music is on your campaign celebration playlist and why.
Well, I would say right at the top of that playlist is Lizzo. I have a few of the Lizzo songs on there, and I think "Good as Hell" is probably the top of that list. And it just because it's an anthem, and I absolutely love it.
Yeah, that's a good one. Your audio has become a little bit choppy. Can you re-enter the environment, and then we have another question up for you?
Sure.
All right, thank you.
How's this? Can you hear me?
That sounds great. Yeah.
Okay, good.
That sounds really great. And then if you could turn on your amplify my voice, that should be under the host tools.
All right, we got that.
All right.
Ready for
Okay,
questions?
our next question is, what can be done on a legislative level to address the need for affordable housing across the state?
That's a really complex issue, but I think what we can do. A lot of that stems from municipalities. But I think we have municipalities that sometimes have their hands tied by state laws. So I think it would be incumbent upon the state to work with municipalities to help them build affordable housing. And I would consider that to be, things that are affordable to families as first homes, and this is beyond government housing, and that's a federal issue. Um, but there are laws that can be changed to assist with this. Basically, it has to be probably the best way to describe it is the state working with counties, working with municipalities, and basically freeing up both counties and municipalities to do the work that is required to build. Right now, we have an incredible housing shortage, which it contributes a lot towards very, very expensive housing, and it contributes a lot towards expensive land, which drives some of the housing costs. So if the state can untie the hands of municipalities and counties, then we can, at that level, start to take the actions that would be helpful in actually gaining the housing and the land that we need.
And we have another question. Where do you stand on Measure 109, which is I'm sure you know, but in case the audience doesn't know, it's the measure on the ballot to legalize psilocybin for therapeutic uses?
I am in support of 109 and use of psilocybin. I think we can. I think we can easily make that jump. What I like about this particular, the way that this particular ballot measure is structured, is that psilocybin will be delivered in a medical setting. So it'll be delivered by people who are trained to deliver it. It's not like you're going to get a dispensary on your street corner. And it'll be very, very regulated and controlled. But the the benefits for this, for PTSD, for anxiety, for depression, I mean, we have the potential to see a lot of really, really great uses for this for people who are struggling with mental health. And if there's been a lot of studies out there on this, and they're all positive. So I think some of it is we just have to kind of get beyond our attitudes on what we think psilocybin is, and understand what good it can bring to the community. But just for PTSD alone, and you think about how much help that could provide for veterans specifically, I think we can make some really, really positive impacts in our community with that.
Mm-hmm. Okay. See if we have any other questions from YouTube. Are there any other questions from our YouTube viewers? While we're waiting, could you talk a little bit about campaign finance reform?
We do.
Okay.
didn't ask a question on YouTube. I don't think that might be somebody else.
Ah, okay.
Do you have a question? Should I start talking about campaign finance reform?
Definitely.
All right. Because I have a few things to say about that. So,
Thought you might.
most people don't know that Oregon is one of 5 states in the country that has absolutely zero limits on the amount of money you can contribute to a campaign. So that, or to a politician. And so that means businesses can give as much as they want, individuals can give as much as they want. You know, if Folskett here in the audience here wanted to write me $1 million check right now, he could do that, and there's no limit. So what that essentially does is it creates a tremendous amount of influence for some people, for people who are giving money, and it is, frankly, it's kind of maddening. The effect of it is, I mean, I think we're number 27 in terms of population in the country, but we are number 1 in terms of cash given to individual lawmakers. So that's a lot of corporate money and money from wealthy donors that is influencing policy. And when politicians were asked to if that cash influences them, they self-reported among the highest in the country that yes, it did. So corporate lobbyists, it's not unusual for corporate lobbyists to just dole out checks. Have folks go to a meeting, talk about issues, and then hand out checks at the end of it. It's happened before. And that's a lot of money.
Oh, no.
Folks are they're not answerable to the people of Oregon. They're answering to their special interests. And I'd also say this, that you know, my opponent was asked to be here tonight and is not here. And but I'm going to give you some facts. Just this year, he received $27,000 from out-of-state corporations. He accepted money from General Motors, from Comcast, from Walgreens, Anheuser-Busch, 7-Eleven, Kroger, Pfizer, Bayer, Novartis, Pharmaceutical Research, DaVita, Physicians, and Chevron, you know, 2 Petroleum, Weyerhaeuser, you know. So this is Weyerhaeuser is the timber company, and in the past 2 weeks alone, he spent almost $55,000 in advertising just in the past 2 weeks, and he's received since August $119,000 from the Evergreen PAC for lot of influence. And it's what ends up happening with that is you get and we see this with other politicians. You get politicians, particularly Republican politicians, with really big bank accounts that did it cut out again?
Yeah, right when you were talking about Ron Noble received the donation from the Evergreen PAC.
Okay. Yeah, so basically what we're talking about is a lot of money flowing into Oregon politics, and that politics influences policy. It absolutely influences policy. And if you look at how much money that he has received from healthcare and insurance companies, you can see why his healthcare votes are really bad. And if you look at how much money he's received from gas companies, petroleum companies, and Weyerhaeuser, you can see why his votes on environment are really, really bad. And so, those things translate. And our campaign is funded by people. It's not funded by PACs. And I think, I'm very comfortable with that because it puts us as being responsible to people and not responsible to corporations and not responsible to PACs. So, if the Evergreen PAC, which is the Republican Party PAC in the House of Representatives, if they give Ron Noble since August 20th, they give him almost $120,000, and then it's time to, they ask him to walk out again to stop things from happening in the legislation, he's going to do it. He is absolutely, he will be tied to them, and he will be responsible to answer to them when they tell him to call, or when they tell him to jump, he'll answer that call. There has been legislation. Here's another thing I can tell you is there's been legislation, and there's people on both sides of the aisle that don't want to limit campaign money in Salem. But there's legislation that we can pass. There has been a campaign finance bill passed in the House, and we can do it again if representatives will stay in their chairs. There is something that's also on the ballot, a ballot measure this year that won't actually put campaign limits in place, but it will allow the legislature to put campaign limits in place. So it's kind of a complicated system in terms of how it can happen, but I think there's enough people, at least on the Democratic side, there are enough people who believe that it absolutely should happen. And so, if I get elected, I will join that group of people without a doubt. Do we have any more questions from YouTube?
I don't see any coming through yet. There are no new questions at this time. Looks like we've got about 15 minutes left for the event.
Okay.
So
We can, excuse me. We can talk a little bit about
a message that says other B measures.
Say that again?
Can you talk about other B measures? I'm not sure what that refers to. Oh, other ballot measures.
Okay. We talked about a couple of them tonight. So we talked about the psilocybin which I am in favor of.
Mhm.
And we talked about the campaign finance reform, which I'm also in favor of. And that's measure 107, I believe. And then we have 108, which taxes tobacco, and also taxes e-cigarettes. And then that money is dedicated for medical and health it's the Oregon Health Authority, and it goes to health programs. And I think that and boy, we keep getting that. Can you hear me now?
Yeah, that's great. I'm not sure why it keeps cutting out.
We keep, we keep. I don't know. Who knows? Who knows?
I don't know. It's never happened before. I'm not quite sure why it keeps happening.
Well,
Maybe
the
it's your
trial,
opponent.
right? The trial run goes great,
Advertising.
and then
Yeah.
we end up in the real deal, and it's tougher.
Yeah, it's the nature of experimenting with a new technology and not being able to do in-person tutorials. So
Right,
but I
right.
think you're being a great sport, and it's we're making it work.
Yeah, we're making it work. That's what we have to do. We don't have any other choice. So did we get to measure 110, the decriminalization and addiction treatment initiative?
No.
That's measure 110. And I am also in favor of that. I think making sure that we are getting some additional addiction treatment into our communities is really, really, really crucial right now. And I think, going through, we had this issue, of course, we did, and we can see how this issue puts ripples out into our community in terms of people who are homeless or, people, a lot of social ills.
Looks like we're having technical difficulties again with Lynnette audio.
For the interruption.
I can hear you. So can you hear me?
Mm-hmm.
I think one of the biggest experiences that has prepared me for the office is my experience as a small business owner. And I think as small business owners, we are by requirement, we have to just, our focus is on getting things done. And we are collaborators by nature, and we know how to deal with what's in front of us. And I think that has definitely been good preparation for this. And it is it's the sort of thing where you don't get to, when you're a small business owner, you don't get to choose who walks in the door. You don't get to choose who is your client or your customer, and you don't care who it is. What you care about is crafting win-win solutions for people that are good for everyone and that keep people healthy and coming back to your business, and keep your business healthy. And I think those experience in putting those things together has been very informative in how I approach problems. I also, it came along with that, I have a great deal of experience in working with economic development throughout the region. And I think that experience will be very helpful to me as we go about crafting policy that's going to help small businesses get back on their feet after we are done with COVID, or even before we're done with COVID. I mean, if we don't want to see our communities become just a landscape of big box stores and chain restaurants, we're going to have to really have some conscious effort towards our Main Street businesses, our small mom and pop businesses, our small farms, all of our, that includes, small manufacturers, all of them, not just retail and not just hospitality, but those as well. And if we don't get some attention to those folks, then we're just going to see corporate takeovers of everything, and we'll lose the identity of who we are here, and lose what makes us really special. Oregonians are super, and especially Oregonian small business owners are super innovative people. The amount of innovation that I think that we see in our small businesses, and I think what you guys are doing here with this space is a good example of that. It is pretty remarkable, and I think that we've got a lot of folks that can put a lot of thought and solutions together to help small businesses get through this.
Right. Well, I appreciate your willingness to participate in this, and your relaxed ability to kind of roll with the audio issues too.
Yeah, it's my pleasure. Things don't always go the way that you think they should. So
they rarely do.
Yeah.
Our last event went so smooth, and so we were kind of expecting things to go wrong, but you just never know. So
right.
Yeah. Looks like we don't have any more questions coming in from YouTube, and it's just about time to wrap up. So if there's any other thing that you'd like to add tonight.
I think the other thing that I think is a big issue for me, and I'll just touch on this real briefly, is childcare. I think that it's not getting a ton of attention necessarily right now, but I don't think we're going to get Oregonians back to work in big numbers until we really resolve our childcare issues. And those were issues that we had clearly before we entered into a pandemic, but now it has made things incredibly worse. I think in all 36 counties in Oregon, every single one of them had a childcare desert in it, and meaning that there's just no access to quality or affordable childcare for folks at some level. And if you look at in our district here, we have one Head Start in this district. That's it. So there's that that pre-K component, but then we just have folks that are relying on a very much a patchwork system, and then that imploded with the pandemic. And so I am hearing stories now, and I hear them almost every day, about women particularly who are leaving their careers. They're quitting their jobs and leaving their careers because they don't have access to care for their children. And we need to have some solutions to that, because we cannot lose the ground that, for women in the workforce that we have made, and it's just not good for families. And part of the biggest issue, part of that issue there is location or spaces or structures to where to put these, but also the folks that work in them. They tend to be low-income women, often women of color, and they're paid terribly. Most child care workers make less per hour than somebody who grooms your dog. And so, we pay people to take care of our pets more than we pay people to take care of our children. And there's something very upside down about that. We need to address that, give people better training, give them a pathway to a career that has benefit for them and their families, and then that benefits all the families in our communities as well, because our children have more stability in terms of the people who are in their lives. So I think, making sure that we get something in place there, but will be part of our recovery for sure. And there are things that we can do. We have to have the political will to do them.
Yeah. All right. Well, thank you for coming out, Lynnette. Thank you for joining us. It's been great to have you here in the virtual town hall. And thank you to our YouTube audience for tuning in. And if you would like to learn more about Lynnette's campaign or make a donation, I'm sure she'd be very appreciative. You can find her on Facebook at Lynnette Shaw, and at her website. Which, could you share your website for the YouTube viewers?
Yeah, absolutely. The website is Lynnette Shaw for Oregon.com, and my name is spelled LYNNETTE SHAW. And really, we need people to get engaged in the campaign at this point. The biggest thing you can do to help us get over the finish line, we are very, very competitive in this race. It's a very close race, and we can absolutely flip this seat. But we need the help from the community, and that right now is phone banking for the most part and letters to the editor. So both of those things are very, very helpful. And if you give us a shout at info@Lynnette Shaw for Oregon, and let us know if you're interested in doing any of those things, and we can either direct you, give you some training, or direct you in however way you'd like to help out with the campaign. Thank you everyone for coming tonight. It was really nice to talk with you, and I hope to do this again sometime too.
After you're elected, we'll have you back, and
there we go.
By then the audio issues will have been resolved.
All right. Thanks, everyone.
All right. Good night.
Good night.
Okay.
Hey, Charlie, is that you?
How you doing?
Good. How are you?
Pretty good. I was having some technical difficulties for a while, but
Were you?
yeah.
This is a pretty cool platform, right?
Yeah, it's cool. I like it.
So, Amy, this gentleman right here
Hello.
is my
Hi.
son, Charlie,
Oh, hi, Charlie. Nice to meet you.
and that's Jorgen in the beanie back there.
my partner Jordan in business and life.
Oh, Charlie disappeared.
Or Charlie disappeared, I guess.
Yep. Oh, he's back. Yeah, I could tell that was you actually, Charlie. It looks like you.
Do you know how many YouTube viewers there were, Jordan? Okay, so 19 total YouTube viewers
Cool.
tonight. That's pretty
Cool.
good.
Yep, we'll take it. Every time we get to talk to a voter is a good time.
Yeah.
All right. Well, I think we'll bow out here then, unless you need anything different.
That's it. We did a recording, and Jordan will
Okay.
probably do a little bit of editing on that, maybe, and then share
Okay.
the link with you too. So if you
Okay.
want to share